We live in Denver, Colorado. I live with my daughter Ellena, my husband Rich, and our dog Daisy. We like to go camping, hang out with our neighbors. We like to travel. When I went in for my routine ultrasound, everything went fine, but they asked me to come back in, I think it was 2 to 3 weeks, to have another one. And when I went back for that, I knew there was something not right. They were seeing something that they were concerned about when I'm laying there for the ultrasound and the tech is taking a jillion pictures. She said, you know, we're seeing all these changes. A lot of things don't look right. So I was able to call my husband, who was at work at that time, and tell him things weren't going right.
When she was born, they noticed that something was different, and we then learned that things weren't normal, and we started to actually see the signs of that about a week in.
Anytime you're talking with a parent in the prenatal standpoint, they're so excited to have a child, and the worst thing they'll tell you is that moment when the doctor says, we see something.
My name is Robin, and my daughter Ellena has CLOVES.
PIK3CA-Related Overgrowth Spectrum, or PROS, is a group of disorders that result in overgrowth of some tissues in the body. Most people think that when we're talking about a genetic disease that it's been inherited or passed on from a parent to a child. But in this case, and in many other human diseases, we're realizing there is actually a mutation in a non-germ cell, so not in the egg or the sperm, not present in all of the person or the patient, but actually developed at some point along the way.
It can affect skin, muscle, bones, anything. And so you get this really wide range of phenotypes, meaning what kids look like, that make it hard to really put them into a single box. But ultimately, they're all related by this single gene or family of genes that are telling their body to grow faster than it really should.
You don't know what's going to happen to your child. They have something that's obviously affecting their whole body. Nobody knows about it. Is something going to come up that she's not going to survive? And nobody can give you answers to that.
My name is Ellena, and I have CLOVES syndrome. Being me is really important to me because I really just want to be a normal kid.
Ellena is a very outgoing kid. She's very empathetic, always wants to make sure everybody's okay.
If somebody's having a bad day, she tends to feel it, wants them to feel better.
Yes, you will see me give my friends hugs all the time.
Riley, right?
Yeah. Good to see you again.
It's been a while. Yes, it has. Years, probably.
She would always be looking for the positive and what to do.
Yes, I've heard of your reputation.
Uh-oh.
No.
I usually say, awesome, or something like that.
Don't get that. Yeah.
It's all
not
good
that
stuff.
bad.
I promise.
She's always the first one to volunteer, always the first one to ask the new kid to have lunch with her or sit with her.
I just want people to know that even though I have a ton of differences, I'm a normal 15-year-old and freshman in high school, just like any other person. I mean, despite all my differences, like, I can do and love a lot of the same things.
One of the parts of the definition of PROS is that it's congenital, so that it's present at birth or very early on. And depending how early that mutation happens in utero, we can actually see some significant asymmetry or differences that can be picked up sometimes on prenatal ultrasound, but not always. So some are surprises at birth.
No one likes a surprise. No one wants to go into delivery and have this be something that you discover immediately. It's unfortunate that not every PROS condition is like that, but certainly the more severe ones are something we're seeing more and more commonly on these prenatal ultrasounds.
CLOVES, it's a PIK3CA mutation, and that's why I have a big cheek. I also tell people that's part of the reason why I had to have brain surgery was because I was having seizures.
When she was born, it turns out the chubby cheek was an overgrown cheek. They sent her right away, I think within the hour that she was born, to have an MRI so that they can try and get more information on it. They found out that the left side of her brain was very different than the right side of her brain. They told us we could probably expect her to have seizures. She didn't have a seizure until day 7.
Here you are, you're a new parent, you're trying to figure out how to not break the infant that you've got, and you're trying to understand things like, well, how to change a diaper, how to feed, and now you're saying that there's a major surgery. So it was a 12-hour surgery. It was one of the times that surgery was done earliest at the time. It was 6 weeks, so she was just born. So there was a lot of risk. So certainly a long, stressful time at the hospital.
I don't really remember anything about my earlier surgeries because I was so young, but I do remember snapshots of my surgery when I was 5. I remember how it felt in the hospital and how I remembered I kind of just wanted the whole non-weight-bearing thing to be over.
With the hemispherectomy when she was young, it created a right side weakness and so some cerebral palsy. So she was just having trouble walking, and it was starting to impact her quality of life. And so the only corrective action available at that time was to move forward with the amputation.
In some of the overgrowth spectrums, particularly CLOVES or Klippel-Trenaunay, there can be really severe overgrowth, particularly the fatty or lipomatous overgrowth on the trunk. And that can certainly interfere with function. It can cause scoliosis. It can make a leg that's too heavy to walk. And it can make a foot that's too large to fit in a shoe. And so those are times that we do consider surgery to help them with their function.
When Ellena was born, there wasn't even a test to diagnose it.
So the NIH clinical guidelines are a set of rules or guidelines for physicians to help us diagnose these conditions.
So when she was 9 and had her foot amputation, we sent that it was all affected tissue. So we sent the whole foot to be used for research and confirmation of the PIK3CA gene mutation for her. So it wasn't until after that we were able to get an actual piece of paper that said she has CLOVES syndrome.
Before, kids who had these various conditions were just given different names for different things. Different providers used different terms for the same condition, and it made it really hard for us to have a conversation nationally and internationally about how to treat and diagnose these kids.
We didn't actually get a diagnosis until she was about 9 or 10. And the relief came from understanding what it was, but it's so rare.
So in our patients with complicated PROS diagnoses, there certainly are a lot of different things that can happen to them. We know that symptoms can change with puberty, with growth spurts, with illness. And so there are a lot of things that patients and families will go through in a lifetime of dealing with this disease.
There's no common course of care for it independent of the diagnosis. So it's a syndrome that's a mosaic, so it actually is in different places on the body and is different for everybody, and it comes out as largely moving from treating symptom to symptom with some common threads. So certainly having the diagnosis helps us because it gives us a label to put on it. But we were so early in that process that everybody's still trying to learn even what the diagnosis means.
I came up with my presentation about CLOVES because I went to a huge middle school and I didn't really want to answer 50 million questions, as well as I just wanted people to know me.
They were able to know why she was the way she was, what she's been through, how they can help her.
And it really was a positive thing, and I think it moved the kids or her classmates into a place where there was information and understanding.
It's a lot harder to bully somebody when you know them.
You're gonna catch. Brother, brother.
Get it.
What?
You? Okay. My name is Amy. My son Adam has isolated lymphatic malformation, also known as ILM.
So Adam was a child that was born with a large isolated lymphatic malformation of his neck, his cheek, his face. It was very visible on his ultrasound that his mother had before he was born. And so even at the time of his birth, it was something that immediately was affecting his ability to breathe, to feed, or to even survive.
So I was pregnant with our second child. Everything was going great. And then I went to my 20-week appointment for our anatomy ultrasound.
I was actually at the police academy with one of my buddies, and I got the phone call that my wife just went to her doctor appointment, and she told me that there was something wrong.
Well, at first we didn't really know what it was when he was first diagnosed with it. He just said that it more than likely was a teratoma tumor. So I went from 20 weeks I had him at 38 weeks, so for the next 18 weeks we're thinking that he had a tumor.
I mean, the whole situation was scary.
I cried a lot.
These kids historically underwent early surgeries, or they underwent tracheostomy where they had a breathing tube inserted into their neck as an infant. There was a high mortality in treating these kids because of infection or just the inability to breathe or feed.
The day of the surgery, we took a picture, and we got a pretty good picture where you can see the mass that it kind of just comes and it wraps around his. You can't even see his shoulder. He didn't have a shoulder, and it kind of just came from here to all back here.
At our institution, at the time when Adam was born, he was treated in our neonatal ICU with a breathing tube, and then he underwent multiple rounds of sclerotherapy, which means through a small needle, we basically pull out fluid from the malformation or that swelling in his neck, and then inject in different medicine in there that causes scarring and causes that malformation to collapse.
They ended up removing 95% of the mass.
So he had multiple rounds of sclerotherapy initially to get his neck and the swelling to go down to the point where he was able to eat and go home and was fine breathing wise.
You want me to put that one away?
But you have to eat though.
But then you need to eat something, puppy.
I was beyond pleased by the results. I'm very grateful for the staff at Memorial Hermann, the doctors that worked on Adam. They did a really good job.
He is very confident. He just, for going through what he went through, he is just beyond proven us wrong. I mean, he's amazing. To go through what he went through, I think for the first 4 years of his life, he's really surprised us. He doesn't let that slow him down. He continues to just thrive, and it's amazing.
Can you reach it? Oh. It doesn't sound? Okay, go.
If you saw him right now, you wouldn't know that something like that happened to him.
Uncertainty's hard, always. And with something like CLOVES, the answer is you move from uncertainty to uncertainty. You've got to make sure that you stay, they advocate for yourselves, that you ask questions, that you understand that nobody has the answers, that nobody can tell you what to do. You got to do the best that you can, and that it'll be okay.
I honestly am proud of myself. I mean, I'm a freshman in high school, and with everything I've been through, I've really tried to just continue on with my life and do things the way my friends do, and just really live a somewhat normal life. So I really wanted to do something to support CLOVES syndrome community because there's only 300 people in the whole entire world who have CLOVES syndrome, and I really wanted to support them. And then I started it when I was in 2nd grade. My mom and my neighbor's mom spent the whole day baking 50 loaves. It sold out in about probably less than half an hour, and I have done it ever since, raising money for CLOVES syndrome.
She's very healthy today for everything that's gone on. So we routinely go into the doctor and they say, well, can you list the medications that Ellena's taking? And then when we say a multivitamin, we get the answer that says, what do you mean a multivitamin? It is great that she is so healthy and doesn't need continued care. I think her prognosis is she can do whatever she wants to do. So we've been extremely lucky in that with all of her hard work, she has a chance to do anything that she wants.
So I want to be a teacher at my elementary school. I have always loved little kids.
So her dream is to be a teacher, and I think that that's certainly open for her. She'll always have appointments, she'll always have differences. We're at a point now where we think we understand at least this round, and she's able to live with that and be very, very successful.
Personally, I hope that she can just do what she wants to do. She has always wanted to be a school teacher since she was 3. I hope that someday she can achieve that, or at least, something around that. I just want her to be able to be as independent as possible, to live on her own, to support herself, the same thing as everybody else wants for their kids. There's just still a lot of unknowns, unfortunately, when it comes to CLOVES and what that means for her and what she'll have to go through. She's always going to have to deal with doctors her entire life. If she ever wants to have children, there's going to be a bigger discussion around that than there would be for other people. So she'll have a lot to think about in her life, but I just hope that she can be in a place where she can tackle all that.
What do you want to drink? Do you want a big red, Coke?
Orange soda.
What kind of soda?
I want soda.
Orange soda? Adam is just doing great. I mean, there's nothing that's being reversed. Everything's just going uphill from there. He's getting to where he needs to be.
And then you're gonna say, oh, my tummy hurts.
One of the biggest things that we're excited about in the treatment of PROS is these targeted therapies.
He has had another surgery just this March. He had his tonsils and adenoids removed. He has severe sleep apnea as well.
He's also been one of our first patients that started this new generation of how we treat kids with his condition, which is a medical treatment.
At 1 year old, they had mentioned that there was a medicine, a trial that they wanted to do on him, and it really changed his structure of his face. He looks a lot better now that he's been on it.
Offering him a medical option to kind of blunt or stop the growth of this malformation so it doesn't continually grow back every time we do a procedure or a surgery on it, which has really been a game changer, not only for Adam, but for lots of kids across the world.
Support is very important. I am lucky enough to have my husband. I know not everybody is lucky enough to have that, but it's something you need to get through something so rough, whether it be a family member or a friend or counseling, anything that you can get. You really need that.
I helped Amy through this time just by being there for everything, just reassuring, prayers, just reminding her that, that Adam will be okay and Adam will be fine.
I hope Adam, when he gets older, he doesn't let what he's been through stop him. He's gonna grow and just be confident and see him be so successful. Hopefully, maybe he'll become a doctor and help somebody else. Maybe he'll invent a medicine or something.
I really miss having you at school.
Ellena has always been outgoing since day one. She's just hardwired that way, and she certainly doesn't get it from either of us. She's the extrovert in the family, we're the introverts. When she was young and very little, and I would take her places, or we would take her places, people staring at her was not uncommon.
I'm sure there's a lot more people staring at me than I notice. But when I do notice people staring, I just smile at them, and they usually smile back, so.
She's not on any treatments today. Her doctor has offered her some medications to possibly help with some of the overgrowths, but we have talked to her about it, and we've all decided that it's probably not worth the possible side effects that can go along with it, and there's still such an unknown. It doesn't seem to really help everyone.
As we've grown and lived with CLOVES as a family, we had a discussion one time that was, hey, would you ever want to have a surgery to maybe make your cheek smaller? Her answer was, why would I do that? Because the cheek is just me. It's just part of who I am.
If it's not causing a problem and everything is okay, leave it alone. We'll still follow you, and if at some point in the future it becomes a problem, we have a dozen different ways of treating that.
She's happy with the way she is. Her big cheek is part of who she is, and it makes her who she is. So she's not in a hurry to try and take a medication that could affect her otherwise in order to treat that. And so we're lucky that there's nothing very pressing or, imminent that we need to try this medication in order to fix it.
Did you struggle in any of your classes in the first quarter, or was it all pretty chill?
I was getting A's and a B in math.
Learning to live with these conditions is really part of that initial conversation with parents, so that they feel like their kid can go to school, they can be like their siblings, they can be like their friends, and they have their medical team behind them to then support them through anything that pops up.
So how I would describe her is happy with who she is, and staying amazingly positive for everything that she's had to go through.
I really want people to know that, even though I have differences, I'm still me. I love things. I love my family and friends, and I'm just living.